Hello and welcome to the topic Viral Hepatitis in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define viral hepatitis, discuss the pathophysiology of viral hepatitis, explain the clinical presentation of viral hepatitis, outline the investigations in the diagnosis of viral hepatitis, and finally discuss the management of viral hepatitis. Let's get started. Viral hepatitis is an infection that causes liver inflammation and damage. Inflammation is the swelling that occurs when tissues of the body become injured or infected. So researchers have discovered several different viruses that are linked which cause hepatitis, including hepatitis A, B, C, D, and E. Viral hepatitis may present in acute form as a recent infection with relatively rapid onset, or it can be in a chronic form. Hepatitis A, or infectious jaundice, is caused by hepatitis A virus, a picornavirus transmitted by the fecal-oral route, then often associated with ingestion of contaminated food. It causes an acute form of hepatitis and does not have a chronic stage. The patient's immune system makes antibodies against the hepatitis A virus that confer immunity against future infection. People with hepatitis A are advised to rest, stay hydrated, and avoid alcohol. Infected people excrete hepatitis A virus within their feces 2 weeks before and 1 week after the appearance of jaundice. The time between the infection and the start of illness averages 28 days, and most recover fully within 2 months, although approximately 15% of sufferers may experience continuous or relapsing symptoms from 6 months to a year following initial diagnosis. Hepatitis B is caused by hepatitis B virus, a hepatnavirus that can cause both acute and chronic hepatitis. Chronic hepatitis develops in the 15% of adults who are unable to eliminate the virus after an initial infection. Identified methods of transmission include contact with blood, blood transfusion, unsanitary tattoos, through sexual intercourse, or mother to child by breastfeeding. There is minimal evidence of transplacental crossing. Blood transmission can occur by sharing syringes in intravenous drug use, shaving accessories such as razor blades, or touching wounds on an infected people. Needle exchange programs have been created in many countries as a form of prevention. Hepatitis C, originally known as non-A, non-B hepatitis, is caused by hepatitis C virus, an RNA virus of the family Flaviviridae. Hep C virus can be transmitted through contact with blood, including through sexual contact if the two parties' blood is mixed, and can also cross the placenta. Hepatitis C usually leads to chronic hepatitis culminating in cirrhosis in some people. It usually remains asymptomatic for decades, and patients with Hep C are susceptible to severe hepatitis if they contract either hepatitis A or B. So all people with hepatitis C should be immunized against hepatitis A and B if they are not already immune. Hepatitis D is caused by hepatitis D virus or hepatitis delta virus. It belongs to the genus Delta virus. It is similar to a satellite virus as it only propagates in the presence of hepatitis B virus, depending on the helper function of hepatitis B virus for its replication and expression. Hepatitis E is caused by hepatitis E virus from the family Herpesviridae. It produces symptoms similar to hepatitis A. Although it can take a fulminant course in some patients, particularly pregnant women, mortality rate is about 20%. Chronic infections may occur in immunocompromised patients. It is more prevalent in the Indian subcontinent, and the virus is fecal-orally transmitted and usually self-limiting. Hepatitis F virus is a hypothetical virus linked to certain cases of hepatitis. Several hepatitis F virus candidates emerged in the 1990s, but none of these reports have been substantiated. Last but not least, the GB virus C is another potential viral cause of hepatitis that is probably spread by blood and sexual contact. It was initially identified as hepatitis G virus. There is very little evidence that this virus causes hepatitis, as it does not appear to replicate primarily in the liver. It is now classified as GB virus C. So viral hepatitis is a disease which initially affects the liver. Hepatitis has several different routes of transmission and comes in several different forms such as hepatitis A, B, C, D, and E, as we have discussed earlier. So now let's look at the pathophysiology of the disease. The viruses enter the bloodstream and spread to the liver. They infect the hepatocytes and they multiply. They then change the antigen structure on the virus site. The body begins to use self-mediated immune response attempting to damage the hepatocytes. In hepatitis B and C, they can continue this process over and over for years. There are 3 stages of symptoms, which are the prodromal phase, icteric phase, and convalescent phase. Based on which phase the patient is in, the symptoms will vary. In the prodromal stage, the virus is in the blood and will release chemicals. These chemicals will create symptoms such as fever, headache, fatigue, nausea, vomiting, skin rashes, and joint pain. In the icteric stage, conjugated bilirubin and transaminases spill into the blood because of damage of bile ducts and hepatocytes. The conjugated and unconjugated bilirubin make the patient appear yellow and present with dark urine. The liver may then become enlarged in this state, as well as it's termed hepatomegaly. The convalescent stage is where the symptoms become better or the patient returns to normal. Let's look at the clinical manifestation of viral hepatitis. So as mentioned earlier, particularly in hepatitis A, the signs and symptoms typically don't appear until one has had the virus for weeks. if one does, may look more like having a more general form of hepatitis, such as fatigue, sudden nausea and vomiting, abdominal pain or discomfort, especially over the upper right side of the abdomen. One may have clay-colored bowel movements, loss of appetite, low-grade fever, dark urine, and also joint pain. As for signs of viral hepatitis, you can look out for jaundice, fever as mentioned earlier, abdominal tenderness and hepatomegaly, as well as muscle weakness can be demonstrated. For lab investigations, there are 3 types of blood tests that evaluate patients with hepatitis, primarily liver enzymes, which we look at the aspartate aminotransferase, AST, or ALT alanine transaminases, and GGTs as well. Antibodies to the hepatitis virus is another blood test that is done. Last but not least, viral proteins of genetic material of the virus itself is another blood test which can be done. Depending on the healthcare practitioner and the lab, we have other tests that may be done individually or as part of a liver panel, which include coagulation profile, lactate dehydrogenase, alpha-fetoprotein, as well as the serum albumin levels. The following radiologic studies may be used to evaluate patients with hepatitis, and these include abdominal ultrasound, abdominal CT scan, as well as an abdominal MRI. Specialized X-rays can be used to evaluate the liver, detect hepatitis, which help make a diagnosis and determine the cause of liver injury. So what are the treatment for viral hepatitis? There are several antiviral medications, which include entecavir, tenofovir, lamivudine, adefovir, talbivudine, which can help fight the virus and slow its ability to damage the liver. These are drugs that are taken per orally. For hepatitis A, there's no treatment that's needed since the infection almost always resolves on its own. Nausea is common, though transient, and it's important to stay hydrated. Treatment of acute viral hepatitis and chronic viral hepatitis are different. The treatment of acute viral hepatitis involves resting, relieving the symptoms, and maintaining an adequate intake of fluids. But treatment of chronic viral hepatitis involves medications to eradicate the virus and taking measures to prevent further liver damage. Acute hepatitis B virus is not treated with antivirals. Acute hepatitis C virus, though rarely diagnosed, can be treated with several drugs used for treating chronic hepatitis C. Treatment of hepatitis C is recommended primarily for the 80% of patients who do not eradicate the virus early, and treatment results in clearing the virus in majority of patients. For fulminant hepatitis, the treatment should be done in centers that can perform liver transplantation since acute fulminant hepatitis has a high mortality without liver transplant. People with acute hepatitis or decompensated cirrhosis as well as acute liver failure shouldn't undergo surgery. This makes sense because one wouldn't want the patient to have severely impaired liver functioning at the time of surgery. Liver transplantation is considered for major surgery, and there is a risk of complications which include one's body rejecting the donated liver. So in summary, we have looked at viral hepatitis, which is the viral infection of the liver. There are various types of viral hepatitis, which include hepatitis A, B, C, D, E, and GB virus C. We have seen the pathophysiology and causes, the clinical manifestations one would have in terms of acute and chronic hepatitis, the investigations that can be carried out to diagnose as well as to monitor the progression of the disease, and finally, both medical and surgical approaches to the treatment of viral hepatitis and their complications. We have come to the end of this topic. Thank you.